Usec Vergeire, from testing to vaccination, any updates po doon, both on the level of our candidate vaccines that are coming in, the negotiations for that, and also our readiness on the ground, the readiness of LGUs, and for that matter, the private sector that's extending some assistance. Ano po yung mga updates natin dyan?
Well, sir, unang-una, tuloy pa rin ho yung ating mga negotiations, no? And kanina nga po, nagpalabas kami ng statement about COVAX kasi may lumabas po na article na sinasabi natin na baka hindi matutuloy yung 20%. Tuloy po yung 20%. Ang naging difference lang po dun sa COVAX facility, yung 15% po ay ibibigay na as subsidy sa atin, walang bayad. Tapos magka-counterpart ang Pilipinas ng 5% of this. So tuloy po, deliveries would push through on the said date that was given by the COVAX facility. As to the other vaccines, yun nga po yung sinasabi ni Secretary Galvez, that yung pong mga unang deliveries ay mangyayari by February 20, specifically yung 500,000 doses nito pong Sinovac, and then for the succeeding months, nandyan na rin po yung sa iba. As to the trials for this COVID vaccine, yun pong Janssen, Clover, and I forgot the other one. Sorry, Gamaleya yata.
Gamaleya, yes.
Yes, I'm sorry. We'll be starting already. These contract research organizations are now engaging with the Department of Science and Technology just to get some guidelines so that they can already assign areas kung saan sila pwedeng mag-umpisa na nitong mga clinical trials, and then after that they will be recruiting their participants already. Yun pong WHO Solidarity Trial for Vaccines, hindi pa ho nakakapagbigay ng protocol ang WHO at saka assigned sites, although we are already preparing for that. At yun pong ating proponent, si Dr. Jodor Lim, ay nag-umpisa na po dito sa mga ospital na napili. Dito naman po sa sinasabi na mga deployment, lahat po, ito pong ating teams ng vaccine cluster, iikot na po sa mga local government. It will start, I guess, Monday, I think Wednesday, with Secretary Galvez and Secretary Duque leading these teams, going to the different local governments just to check if they are prepared already, makita kung ano pa yung gaps, makita po kung ano pa yung mga pangangailangan para mapunan na po ng national government. Master listing is ongoing. The deadline for them to be able to consolidate all at magkaroon tayo ng isang buong master list is on January 31. Logistical requirements as to the freezers and the other logistics, inihahanda na po, nakakapagkausap na po sa mga private institutions.
Usec, are you looking closely at the Janssen vaccine? Kasi maganda siya, single dose lang, Mas madali for administration, logistics purposes. Anong status ng negotiations natin with them? Saka, is there any growing preference for that vaccine?
Oh, well, at this point, we don't have any preference at all, ma'am. It is, as I always say, if there is an EUA that is issued by the Food and Drug Administration, that is acceptable to us already. Now, with the Janssen, the clinical trial has been approved. It's going to start here in the country. As to negotiations, it was also mentioned by Secretary Galvez before that there is this negotiation, At aantayin lang po natin maybe towards the 3rd and 4th quarter of the year po yan.
So ma'am, ano nang visibility natin in terms of vaccination this year? Kailan kaya likely magsisimula? At kailan kaya talagang mako-cover at least yung a substantial portion of the population, if not 70%? How does it look now?
Yes, ma'am. Actually, yung mga parating, yung sa COVAX facility at saka yung sa Sinovac, pag dumating po apparently on February, we're just going to prepare, distribute, and have the local governments mobilized, engaged. Siguro po mga March, makakapag-umpisa na po for the healthcare workers. Tuloy-tuloy po yan. And this is going to be around 1.7 million of them all, kung wala pong tatanggi. Tapos, pagkatapos po niyan, makakapag-umpisa na rin ng some parts for the senior citizens kung dadating na nga po yung pinapangako ng mga bakuna for this March, April, and May. Meron na hong ibang bakuna rin kasi na nakita ko na rin dun sa mga dokumento na parating na rin po come May, Magde-deliver na rin po sila. So magsusunod-sunod na ho yan. Although it's going to be in tranches, But I think it's going to be appropriate because we did our prioritization per sector. So matapos ang isang sector, dadating ang isang sector, like the senior citizens would be next and then indigent. So looking at all of this and with the plans of our vaccine teams, sa tingin naman po natin, kahit na po yung unang prioritization natin na 20%, no, with all of these vulnerable in this class A na nilagay natin na priorities, would be able to receive the vaccine for this year.